8 million South Africans have now received a COVID-19 jab, and the country's supplies have been bolstered. We now have 10 million doses in storage. Newly appointed Health Minister Phaahla gave an update this morning on government's fight against COVID-19. Let's get some analysis now. The health expert, Dr. Kgosi Letlape, joining me once again in conversation about this situation. So, Dr. Letlape, let's start with the ebb and flow of the pandemic. It would seem we are tapering from the crest of the third wave, but not nearly as fast, and it's not as sharp a decline as we saw towards the tail end of the second wave. What are some of the reasons, as you look around the situation, as experienced by healthcare workers and also various players, epidemiologists and others? What do you think are some of the main reasons why this decline is not as sharp as we would have preferred?
I think we need to note the numbers. If you compare the third wave with the second wave, Gauteng contributed massive numbers in the third wave. Even though we've seen a significant decline in Gauteng, it comes from a very, very high base. And because of that, the numbers in Gauteng are still significant that contribute to the numbers. So it's because of the huge upsurge in numbers in Gauteng that we're seeing the decline steadily. But you also see a pattern, as the minister has alluded, that the coastal areas are increasing. So even though Gauteng has come off the peak, Free State has stabilized, the Capes are rising. The Western Cape is rising. The Northern Cape is rising. The Eastern Cape, in terms of numbers, is rising. So you see the pandemic not being uniform in all parts of the country. The same as the first wave, it started in the Western Cape, and Gauteng only came on later. So we see that pattern. And I hope that from the authorities, they will now come up with localized actions. This thing of one standard in terms of lockdown in the country, when we have fires that are in different stages in a different country, should be adjusted. There should be local adjustment. We should be far more stringent in the Western Cape now where it is rising. Gauteng, we should have been stricter with Gauteng at a time when it was the major contributor to the peak relative to the restrictions that should have been in other parts of the country. So we need a more directed, localized response. If you look at the Australians, they will close down Sydney. They will close down Melbourne, if appropriate. So they are coming up with appropriate measures to where the fire is burning the most.
Is the failure to adopt such strategies as you are talking about now, and to be agile in that way, part of the reason why we see this lag behind, in as far as, you have one province that becomes the epicenter, and just as you're dealing and responding to that situation, a few weeks later, you start to see these fires that we talk about, these smaller fires becoming bigger in other provinces. Is that part of the equation?
Yeah, I wouldn't call it a failure. I'm just suggesting that we be more nimble, just like has been articulated today in terms of the areas where it is rising, the areas where it is decreasing. Let us now adopt a strategy of appropriate response at a local level. So I wouldn't consider it a failure. It's just from what we've learned before, we need to be nimble and keep changing our approach to deal with this virus. And what I'm suggesting is that the patterns are giving us information where we need to probably come up with more stronger localized actions where the fires are burning the most. So I'm not seeing it as a failure. I'm seeing it as a learning, and let us adapt to what the virus is telling us.
So, Dr. Letlape, the vaccine strategy seems to be gaining momentum. We're hearing this morning that we now have some 10 million doses in storage. There's talk of, mobility and being mobile in terms of setting up pop-up vaccine sites. For instance, in the Western Cape, they've already started doing this. Do you foresee a situation where this ramps up even further and perhaps helps us to ease some of the restrictions, perhaps, I don't know, towards the later part of this year? And more importantly, what's your thinking around the possibility of a fourth wave in a context where we are ramping up the vaccination drive?
I think, the virus has its own agenda. It should not be a question of, are we going to have a fourth wave? The question we should be asking ourselves is, what steps are we taking to make sure that we attenuate the impact of the fourth wave as much as possible? And that should be the key message. And I'm hoping to see that we expand beyond corporate involvement in the vaccine program. Let us now look for all other healthcare professionals, independent nurse practitioners, independent family and general practitioners. It's about time that they are brought into the vaccine strategy. Now, the advantage of bringing the GPs and the family practitioners into this is that they take care of people day to day, and they would be able to continue educating on vaccinating, promoting vaccination, particularly to the vulnerable groups. They see the people that have comorbidities that come to see them, and they would be able to be a great addition to what is happening. What they also provide is that some of the practices are where the people live. So you would be, by bringing them in to the vaccination sites, you will be improving access to the people to vaccines. But you will also be aiding your pharmacovigilance and reporting. Let them be recruited to help SAPRA and to help Sisonke and all other people in terms of reporting of these incidences. It's much easier for a person that has a family doctor to go back to the family doctor and report to the family doctor. When you're sick and you've been vaccinated at a corporate site or a public site, you go and look for your GP if you have access to one. You go and look for the nurse practitioners if you have access to one. So I hope that will be expanded. But more importantly, I hope people also listen to what is being said. The DG ended by saying the non-pharmaceutical methods are important. And they're going to stay with us at least to the middle or the end of next year. Avoiding gatherings is important. So personal behavior is key in terms of curbing the pandemic.
Thank you so much, Dr. Letlape. I just want to squeeze in this one very quickly, Dr. Letlape. I'm completely out of time. The announcement of Dr. Joe Phaahla as the Minister of Health. He had been a deputy minister, deputized at least two of our recent health ministers, and many were calling for him to actually step up and be appointed in that role. Your take on that appointment?
If you wanted somebody to hit the ground running, there was only one choice, Dr. Joe Phaahla. It's an excellent appointment from the president. He has the experience, he has the temperament, and he has the support of his colleagues and the health fraternity. And I personally am excited, and I am, as always, willing and able to assist. We couldn't have made a better choice in a successor to Dr. Mkhize.
All right, I've got to thank you.
And we also congratulate Dr. Romo as the deputy, because he also has a wealth of experience in health, being a previous MEC, having chaired currently chairing the Portfolio Committee of Health in Parliament.
Dr. Kgosi Letlape, I've got to thank you for your time. Always generous with your time and insights here on eNCA. You're watching NewsLink.